This is Major Lazer.
I'm Moon.
This is our brand new single.
Well, really good afternoon. Hello, hi, this is Dr Vili, and thank you for joining us here at KNR. We are bringing you radio according to you as promised. It is 5 minutes past 2, and it is a beautiful sunny weather in East London. And we did take you back with Baby Winans, a city it all comes down to love. So, Bayebatike Sundays are for lovers. And for people, abangathandaniyo abazi singles, I do not know. Uba benza ntoni ngale mini. Anyways, that is not the topic yanamhlanje. Today, sitawuthetha with our guest who's actually here. And the name of this show, it is Champion Mindset with Dr. Vili and Sinayeke Anelisiwe Mntambo. And Anelisiwe Mntambo, right? Yes, correct. Yes. Thank you so much. Yes, we will be talking about everything physiotherapy. He did BSc Physio at UCT, and he's currently doing his BSc Masters Sports Sciences, right, at Wits University. So if ever this is the field that you're interested in, if ever you want to know anything about rehabilitation, we're talking about injuries, we're talking about post-ops, stroke, neck, and back pain. Please do chill with us. Ngalemini, for the next hour. And yeah, Anelisiwe, can you please introduce yourself to the guest?
Thank you so much for that intro. So igama Anelisiwe Mntambo. I know necessarily I think I wanna just come back to the fact that you said Anelisiwe. There's a lot of people that
there's Anelisiwe instead of Anelisiwe. I get you.
All the time they expect they're gonna meet like a girl,
a lady.
Yeah, a lady. Yeah, but Anelisiwe Gama, Mntambo. I'm from King Williamstown. That's where I grew up. And yeah, I went to school there. Then to go college. After that, I went to Cape Town. Actually took a gap year before studying. Played a little bit of rugby. Studied in Cape Town at UCT, and yeah, finished 2015, and then I did my concert this side. I came back home at Bishop Hospital, and then after that I worked at one of the hospitals here, private hospitals here in East London, the rehab facility, physical rehabilitation facility, and I worked there for close to 5 years, and then I started my own practice in 2021, which is now currently based in Vincent. Yeah, so there's a lot to chat about with regards to my practice, but that's where I'm currently at right now.
At the moment.
Yeah.
Okay, thank you so much, Bapulapuli. That is Anelisiwe Sixalela. But before we actually get to the whole practice thing that you've actually decided to start, we actually just want to know what is physiotherapy for someone that is actually sitting at home and they are thinking, Uba, they want to do this physiotherapy, but they don't know what it is. So please do explain that to us in layman's term.
Okay, good question. So I'm going to start from the beginning also, because I also took some time to actually get into understanding physio. So I actually wanted to be a physio from as early as grade 9. The definition I actually looked up. I think we gave we had an assignment for orientation, orientation. There, when you do career skills and whatnot, that's where I actually came across the definition of physiotherapy, where it's basically trying to rehabilitate someone who has gone through some event that has resulted in them being disabled, or basically disabled or injured and unable to physically do the things that they used to do independently before. So, for example, if they were able to simple thing as walking, and now they sprain their ankle, and now they need to find a way to get back to walking normally again. Or if they've had a stroke, of course, your more serious illnesses, so strokes, or if they've gone under operation and that sort of stuff. So um, when I came across, yeah, so basically, we would want to try and rehabilitate them through exercise to get them back into their independent function, as independent as possible. I like to think of it as being able to empower someone. Um, and for me, at that age, or grade 9, it resonated a lot with me because I believe that I'm a person that empowers. I want to empower other people. And yeah, so physiotherapy, I don't know if I'm answering the question. I think I'm going in the
It's
direction.
okay. It's okay. No worries.
Yeah, so physiotherapy basically just involves using exercise to try and rehabilitate people to regain independent function. And independent function involves anything from getting out of bed in the morning, being able to move in bed, sit on the edge of the bed, stand up, walk, um, get to the car, drive, all sorts of things. We work a lot with other therapists as well. But yeah, it's quite broad. Initially, I think for me, when I got into physio, I got into it for sports. I thought because I played a lot of sports in high school, in school, um, I wanted to be I wanted to be somewhere within sports. Um, I obviously wanted to be on the field. I really enjoyed rugby, and I wanted to be on the field. However, um, as many people would probably also say, our families or our parents didn't always see sport
Career.
as a career. Yeah,
Mhm.
yeah. So a lot of the time you need to work hard on your books as well
Of course.
to make sure that at least you've got something to fall back on.
Mhm.
And luckily, well, I don't know whether it's luckily or not, but um, when rugby didn't work out for me, I had my books to fall onto, and I was able to pursue my career in physio, which I mean I've thoroughly enjoyed. Even though I didn't necessarily in the beginning, I wanted to do sports specifically, but when I got into varsity, you actually got to realize that physio isn't just about sports. It's
Of course.
so broad.
It is.
You start working in a hospital, you start seeing so many things within the hospital, like different conditions. You're in an ICU, um, you're in the wards, you're in different units within the hospital, burns units, peds, neuro, like it's very broad.
Of course.
So I was actually very happy that I had chosen this career because of how many doors it sort of opened for me. Not necessarily, um, or should I say, it opened doors in the sense that because I'm a person that empowers, or wants to empower people, I now had so many opportunities to be, so many touch points where I could actually empower people in so many different ways, and not just within sports. Yeah, I think I remember the.
All right, thank you so much for that. Now, the other thing that I want us to actually get into, right, is the university requirements. Obviously, there's a lot of universities that actually provide this course, but the requirements mainly and the duration of the course.
Yeah. So with physio, physiotherapy is it's a science degree, so it's a bachelor of science degree. You have to have an honors. So it's not like you do 3 years and then then you decide to do your honors year elsewhere. Well, the whole degree is actually 4 years, and you graduate with your honors.
Okay.
Yeah. The requirements, I don't know if it's still the same. I think it is still the same. Back when I was in high school, you needed to have maths. Maths is a requirement. You needed to either have physics or bio, any one of the two. But you definitely had to have English because obviously it's taught in English. a lot of the terms, a lot of the explanations are in English. You need to really understand what they're trying to ask you, or if you're trying to define something, you need to be able to explain it in English. And a lot of the information that there is in English.
Okay.
Yeah, so those are the main ones. And then, yeah, those are the main ones. And obviously, it needs to be above
60%.
Yeah, it needs to be level 5 and above.
Mm-hmm.
Yes, I think I've answered you there. Yeah, and then I think there's other things. I mean, like your other universities might have entry requirements. We used to do it NBT.
Mm-hmm. The NBT test.
Yeah, those benchmark tests that you do. I don't know if those are still around, but yeah, that's about it. Yes.
Okay, baphulaphula be-KNR siyamuva u-Anelisiwe esixelela banzi with regards to physiotherapy. Now, I would actually like us to engage, right? So if ever you've got any questions or comments, please do send them to 066 137 2723. So any comments and questions that you actually want to ask, igesi yethu namhlanje, please do send them to 066 137 2723. So the next thing that I actually want to ask you is, like with physio, right? Abantu abaninzi, they'll tell you, no, massage, no, I actually want you to actually bring the facts. So what is it that you actually like the conditions that you actually just see on a day-to-day basis?
Yes, yes, yes. No, this is a good one. So for physios, generally when someone um, hears the word physio, a lot of the time they think massage.
Of course.
If I introduce myself a lot of the time to anyone, they just like, oh, so I know my back is sore. Can you massage me?
My neck is sore.
My neck is sore.
I know.
Yes, yeah. And physio, as I explained earlier, so it's very broad. To give you perspective, massage, I think we only do it like, I think it's in first year, first to second year, but it's a very short module. We do it like, I think, over 2 months or so, where we just learn the different kinds of massage. And then at that stage, we just basically being introduced, and it's you sort of being introduced to how to feel the different tissues within the body. And that's how it becomes. I mean, we use massage, don't get me wrong, we use massage a lot. And especially for me, for example, I work within sports, and a lot of the time I will use manual therapy. So we sort of call it manual therapy, or some people call it myofascial release. There's many terms for it, but a lot of, like, in terms of layman's terms, people will say, yeah, no, it's a massage.
Of course.
But there is different sort of descriptions and explanations for the way that you actually manipulate the tissue. So myths, the myth is that physiotherapists don't just massage. We don't massage.
Thank you for clarifying that.
Yes, clarifying that completely. The main thing that we do is we treat when there's an injury. A lot of time, maybe there's some kind of issue within the tissue. Let's say you've got a muscle spasm, or muscle tightness, tissue tightness of some form. And then we basically use specific techniques to manipulate the tissue. And in that way, we are basically helping the body to move better, to be able to function better, or that muscle segment or that part of the body to move better. And that's basically what physios do. I'm saying it in a very simple way. I'm trying to be as clear as possible. Please, if anyone needs more clarification, they will ask in
the comments.
Yes, yes. In terms of the sort of conditions that I see on a daily, so a little bit more about myself. So I work a lot with sports players. I work in cricket and rugby. So I see a lot of those injuries at the moment. And I've been doing so now. I think it's a good it's just over 5 years I've been working within sports, and majority of that professionally. And then, so those are all your sports injuries. That could be anything from ankle sprains, um, knees, shoulder injuries, rotator cuffs, back injuries. So I really enjoy that. It's I think that's where my passion lies. As I said, I think it resonates a lot from why I actually got into physio in the first place. However, because I got exposed, I've been fortunate enough to have been exposed to quite a lot. Having worked in the hospitals, having worked in a rehabilitation facility, a physical rehabilitation facility, I got exposed to quite a lot of conditions. So stroke conditions. I'm actually NDT trained, so um, I work a lot with your neurodevelopmental conditions or your neuro conditions like strokes, traumatic brain injuries, spinal cord injuries. So I learned a lot even there. I got a lot of experience there in terms of how to manage um, those conditions as well. I still see quite a bit of stroke patients, a lot of stroke patients actually, and spinal cord injuries. See a lot of those. I am also in the hospital. So in the hospital, in the private setting, you get to see a whole range of conditions there. Yeah, so that's me on a daily. Yeah, that's me on a daily.
Okay, that is actually like very interesting, right? Because now the next question that I was going to ask you was, what are the benefits of physiotherapy? We have they're actually just chilling at home and we're like, ah, there's no need for me to go there. Yes, I've got pain up and apayana, but there's actually like no need for me to actually go there. So need to actually get up and take a stand to say, you know what, let me actually just like tackle this issue in case or mhlawumbi ingakhosi anything that will actually like be further damage going forward. So, what are the benefits of like a physiotherapy? You have mentioned a few, but I just want you to actually like explain broader so that our phulaphuli bakwazi understand that and umuntu naxa ehleli endlini azi as well. Okay, you know what? I think I actually do need this help.
Yeah, that's also a very, very good question. So the benefits of physio, there's quite a lot. I think if I could, I'm going to try and simplify it so that everyone can sort of see if they can resonate as well. Basically, you want to be sure of what you are doing. For example, you've got back pain,
Of course.
and
Which is common.
which is common.
Which is common.
Which is quite common. And someone will say, you've got back pain, and maybe you need to start moving more. You need to start exercising more. Or maybe someone will tell you that because you've got pain, maybe you shouldn't move. You've been doing too much. You should rest. And maybe it's something that you believe because you're in pain. Maybe you've done too much, and maybe you should rest. A lot of the time, people aren't necessarily sure of where they are in terms of um, what's going on in in the pain that they're experiencing. If it's back pain or the knee pain or whatever, they aren't necessarily sure of what's going on, and hence they would then go and ask or want to meet up with or set an appointment with a therapist or a doctor to try and get answers in a direction or get healing, some advice. So a benefit of physio is that you would basically get. I'm very big on trying to educate my patients, so trying to have an understanding of what's going on with regards to the injury. Um, if let's say if it is an injury, whether it's overuse or if it's something that's happened quite acutely, um, you will get an explanation in terms of what's going on. And the physio, what they would do is they would do an assessment, a physical assessment. First, they would ask you what the problem is, give do a nice proper subjective examination where they ask you questions to try and figure out what's going on. And then after that, they would do a physical examination where they would ask you to do specific physical movements or to try and figure out again like what's going on. Thereafter, we would do treatments. Treatments sometimes involve us using our hands,
Of course.
and then also being able to prescribe exercise. So how to actually start to move or start to improve um, functioning of that specific joint or part of the body.
Mhm.
And because at the end of the day, or what we're trying to achieve is for you to start moving better or without pain. We're trying to get you from a point of where you've had pain to a point where you've got reduced pain or
Or no
even
pain at
no
all.
pain at all. Yeah. So I hope you're picking up all of these benefits as I'm explaining. So uh, seeing a physio basically gives you all of these. And the thing is, with physio, we actually get to spend a lot of time with you. Unlike, I'm not going to mention or say to you which other departments
I
we
like.
tend to, which can be quite quick. Um, yeah, so we tend to spend a lot of time to try and understand what's going on with
The patient.
with the patient. Yes, yes.
Okay, Bapulapuli, that is Anelisiwe Mntambo. And right now, we actually did have a bit of a problem where now people are actually just telling us ukuba the sound is actually not so loud, but we actually did try to rectify that mistake. I really hope uba ayisilimazanga kakhulu. And I did say that if ever you do have any comments or questions, please do send them to 066 137 2723. It's 066 1372723. So there's actually like one thing that I've always been interested in, right? Like when it comes to
Yeah.
physio and stuff. I want to know, and I'm sure I'm not the only person that wants to know this. What is dry needling and cupping? Like, what do you guys do? Intoni leyo? Please explain to me because wow,
Yes.
Sana.
Yeah. So, in Ali,
Intoni, what is it?
Okay. So dry needling. Basically, it's. I'm not going to give the specific
Description.
description.
Mhm.
I'm just going to try and explain it. Basically, we're using needles that are very thin. And basically, what those needles do is that they will obviously pierce through the skin,
Mhm.
and we try and cause micro trauma. So this is basically almost causing little tears into the muscle,
Into the muscle,
into the
of
muscle or
course.
that specific tissue. And what that does is that it stimulates blood flow to the area. And that is
I
what
get
stimulates
you.
healing.
Of
Okay,
course.
so all
Of
of the healing
course.
properties go to that area, and all of a sudden you start to get a better movement and a better function of that muscle. And that's the simple explanation that I like to also give my patients with regards to dry needling. I use it quite a lot. I like it because it's quite direct,
Mhm.
and a lot of my athletes they prefer needles because it's actually as much as it's still painful, but sometimes it's less painful than using hands because when you are doing that um, myofascial release with the hand, you can experience quite a lot of pain because it's a constant and deep pain that I'm using to manipulate the muscle, which can get quite sore with the hands. Whereas with the needle, it's a quick pain that you feel,
Mhm.
and over time it actually releases. So for those of you who haven't had needling done, you basically put the needle in. Um,
I
uh,
haven't had
you
it, but
haven't,
I've
you
been
haven't had it.
yeah, but I've been advised. So I'm like,
Yes.
I'm Kendibu's and I'm Shanja, what is this?
Yeah, yeah. So basically, I would put a needle. At first feel on let's say it's your back. You've got back pain, you've got a back spasm. I'll basically feel with my hands some tension along your the muscles of your back.
Mhm.
I'll try and find a point where there is the most tension, where it's quite sore. A lot of the time, we might get a bit of twitching or twitch response. when applying pressure to the area. And then basically, I would then put a needle through. I would put a needle very quickly into that place or that area of highest tension. That will obviously cause pain. You feel a prick, and then it might feel like a deep ache inside, and we might see the muscle twitching a bit. And then we'll leave the needle there for a good minute or two, up until the pain or is a little bit reduced or like no pain at all. And then what I like to do with my patients is I actually like to move the needle a bit, and that is a bit painful as well. But again, we wait for it to release again, and that's we sort of work through the muscle like that, and that's how the muscle tends to sort of release, and we get better movement. Yes, within the tissue, and that's dry needling.
And cupping?
Sorry.
And cupping?
Cupping. I also use cupping as well. So cupping, I I like to think of it as trying to again bring blood flow to the area again, and also trying to release tension within the muscle as well. Look, there's a lot of explanations and there's a lot of um, contradicting research about it. I find it works add on in terms of working with um, muscles, trying to release tension within muscles. I like to, as I said, so I like to use the hands. I like to use needles, and cupping is one of the other tools that I use in addition to exercise. Exercise is like the primary one that I would normally use, um, or always use in terms of treatment, and then cupping and needling are an add-on to try and get more movement within the muscle or more flexibility within the muscle. Yeah.
Okay.
Yeah.
I actually think, I did get what I actually wanted to hear from you, and thank you so much. I did say, Uba, if ever you want to engage with us with via comments or questions for Anelisiwe Mntambo, please do send them to 066-137-2723. It's 066-137-2723. So now, you did work in the government sector, and you do also have an experience with like the private sector. I want to know, what were your challenges at government, and also what are the challenges that you're facing now in the private sector? But before that, you can also just tell me why is it that you actually decided, Anaman, the government sector is really not for me. Let me just jump to the private sector.
You're taking me back now.
Let's go back.
Yeah. You're taking me back to government. Yeah, it's tough. It's tough. Look, government. I think it's tough there.
It is.
It's tough. Our health system has been it's under a lot of pressure.
Of course.
From a state point of view, it's under a lot of pressure. If you look at the numbers of like the population and how much it has to the lack of resources within the hospital to try and meet the demands of the population. I mean, so many people require care, health care, and there's not enough resources within government. So, having come from university, I'm now going to talk about my challenges. Having come from university, I was in Cape Town, and most people know in Cape Town, even when you do community blocks and when you go into the hospitals there, there's quite a lot that is working that side.
Of course.
And also having worked with other clinicians and working under me, other clinicians, there's a lot of drive and like motivation and push.
Energy.
Yeah, when you're still a student, there's a lot of drive and push, and you want to do you still out of university, you're fresh, you want to actually work, you want to learn as well, you want to learn as much as possible. And when I came out of university, when I did my ComServe, I struggled to get the same kind of motivation, especially in the hospital that I was situated in. There wasn't a lot of support. I didn't feel that I had enough support to grow me in terms of um, as a clinician, clinically to know like different conditions and know how to work, how to treat certain conditions. I mean, you straight out of university, where you had people who would mock you and comment and criticize you, and now you're out in the open on your own.
On your
and
own.
You've got these people that have specific kind of conditions that, and they're looking to you for help, and you must take the pain away. You know, in a sense, so it's quite daunting, and at the same time, like I felt that I didn't have enough support for me to continue within government or in that setting
Okay.
to grow. And then, of course, that's just me personally. And then, of course, there's all these other issues of lack of resources. You have to wait months to get specific resources like
Crutches,
um,
wheelchairs.
wheelchairs. You have to wait so long. And these are things that are, I mean, a physio department needs.
It's a
For
basic
example, it's
need.
a necessity. Like oil, we need oil to release muscles. When there's no oil, like how are we gonna? We need specific um, equipment like stairs. To how are you gonna test a patient if they can climb upstairs when you don't have anywhere where the stairs? So things like that. So that sort of discouraged me quite a bit. Now, speaking specifically about me, other people may have different experiences, but that was me, which is why I actually went to other hospitals to try and gain all of this experience. I went to a bigger hospital to try and get more out of it, or out of my consult, yeah, and which really helped. And then I think at the end of my ComServe, I then went on to oh yeah, I was waiting. I applied to work in government still, but then during the time that I was waiting, I went to locum at the private rehabilitation facility that I was at. That's where I actually felt like I was gaining a lot of experience, hands-on experience, and I was actually learning so much because I was working within a team, and I was working with people that very closely with doctors as well. And I was able to work with patients not only for a short amount of time, but through like a rehabilitation process, like over 6 weeks to 8 weeks to even like 12 weeks. Your spinal cord injuries, your stroke patients, amputees. So the private sector it opened up my eyes so much more. Um, so then I was still waiting for like my application process, and when the results came, or when I was called for the interview, I went for the interview, I got the job, but I actually didn't take it. I didn't go back into government because I felt like I wouldn't learn as much as I was learning already within the private.
Private practice.
Yes, within private sector. And then, yeah, I mean, I went on, I think, close to 5 years. And then I always knew that I wanted to have my own practice. I think even whilst I was working within
The
the,
government sector.
even whilst I was working within the government sector, I knew in the back of my head I would own my own practice. But even when I got into working for the private rehabilitation facility, they knew. I even told them, listen, I'm here to learn. I want to be a leader. I want to run my own practice. I want to know how the system works because there's a big system behind treating a patient. There's you need to learn how to do billing. You need to learn how to market yourself.
Of
You need to
course.
learn how to manage. You wear so many hats. You basically become an entrepreneur. But
That's
you
what it
haven't,
is.
yes.
That's definitely what it is.
And you haven't necessarily learned any of those business skills throughout your varsity career. Yeah. So yeah. So I think the question was towards
The challenges,
the challenges.
and also what made you decide to actually shift from government to private sector?
Yeah, yeah. So I would say the main shift is just because I wanted to learn a lot more, and the private sector gave me that exposure. It allowed me to learn a lot more. And in terms of challenges in the private sector, um, look, it depends who you are working with because it can be a bit cutthroat in private sector. It's very easy to your reputation is almost it's basically
It's always on the line.
Yes, it's on the line. If people don't trust you or don't if you do something that is I don't want to say incorrect, but is not in line, it's easy. You can easily your
Unethical.
reputation. Yeah, you can lose so much, and it takes a lot of hard work to try and get it back. Yeah, yeah. So that's one of the challenges, but it's also, I mean, it's good. You want that. You're working with people, so you need to make sure whatever you're doing, it's in line. It's good. And the other challenge I would say is, I mean, like I said, it's depending on who you know. It's up and down. Private sector, if you don't work, unfortunately, the results show and you sort of fade away and you suffer. If you don't get enough work within private sector, if you don't get enough clients, the business, it's a business. Um, you basically, you don't make an income and the business goes down.
Of
Yeah.
course.
So that's a private sector. Yeah, yeah, yeah. And it's very important to try and work to do your research quite well. Yeah.
That is actually great. Thank you for all this like insightful information. So now I want to ask you for someone that is actually interested in starting their own physiotherapy practice. What is it exactly that they need? Just the basics that they need to actually just start up and get going.
Yes. Also, very very good question. I always say this to people. People will always ask me like, "How did you start?" And everything. It's not easy. It's the first thing. Um, Try and acknowledge that it's not going to be easy, and get over that as quickly as you can. Okay, it's not going to be easy. Okay, good, fine. Now, next thing you need to start.
I need to work.
You need to just work. The important thing is to start. If you start after that, the next thing is to be consistent.
Of course.
Yeah. If you start, then you become consistent. Then everything else, I promise you, will fall into place. That's just the framework of it. Start. Get over being anxious to start. Get over that. Start, and then after that, be consistent. If you got those three things, then at least you get going. So how I started is even during whilst I was working for the rehab facility, I would I registered my practice or I registered a practice number, which you don't necessarily um, yeah, you don't necessarily need if you are locoming, for example, working and I need someone else. You don't need a practice number, and I say locoming because that's where you actually learn how a practice is actually run and the core business.
The ins and outs.
Yes, the ins and outs. So you can learn there, but you can register a practice number. Um, and then once you have a practice number, you basically then, if that helps you to be able to do billing. So billing is the process for basically claiming for the treatment that you've done. There's a whole process. I'm missing a lot of points. I'm trying to just pinpoint the important ones. Yeah. So make sure you try to get your practice number as early as you can. Even if you're still working for someone else, you're working in government, try to get a practice number because that will help a lot in helping the different medical aids to know your banking details, to know like your address, all of those sort of details which come in handy once you've actually opened your practice and you are practicing. I started with that. I got my practice in I think in 2018. And even then, I wasn't billing through medical aid. I was just taking cash, but I was still treating patients. And then getting lost now in my thought process. And then yeah, just try and get a client, a client, a client. Uh, um, Sorry, I'm losing my train of thought now. Sorry.
It's okay, totally understandable.
Yeah. You basically want to get a list of clients.
Clientele.
A clientele, yes. That's the word. I think I'm running out of English now.
You're so ridiculous.
Yeah.
It happens to all of us, don't worry.
So you want to try to get a client, a clientele that you can start seeing. I started with home visits. I never had a space to operate. I got myself a bed, a treatment bed, and obviously I needed gloves, I needed oil, I needed your protective equipment, so I needed like an apron. If you need a mask, use a mask, and then and then you start booking patients. It's as simple as that. But also, I would advise trying to make sure that you work under someone before. Just have an idea of knowing how to, because the things like consent, you need to draw up like a consent form. You need to draw up, there's a lot, man. But that you can learn by working under someone. Try get a mentor. There's a few mentors that I have that have helped shape the practice that I have today. And like, don't be afraid to ask for help. And I found there are people that will sort of keep to themselves, that won't share information. But I've found that there are people out there that are willing to help. They're willing to help. They're willing to give you the or at least
direction.
Yeah, the good direction. I'm one of them.
Oh my goodness, that is actually very interesting. So Vili ke baphulaphuli we're still here chilling with Anelisiwe Mntambo. Yes, we are actually kukhona abantu that are actually engaging with us. I'm actually just trying to read this. Usula Vili, oh, this is actually crazy because that's my twin sister, by the way. She is sending heart emojis. We love you too, sis. And then we also do have WM Physiotherapists. I am gonna. I'm thinking that you know who this is. Well, they're saying that they're enjoying the discussion in great nuggets. Siwe. So that's well done for you. So the other thing, thank you so much for the comments, guys. And now we are actually running out of time, but we still have a few minutes to spare. And I actually just want to ask you, right? We are talking about bravery. You just have to start. There's nothing you can do. I mean, it's cutthroat. You just have to start. If ever there's anything that you feel like I want to do this, and if ever you are very, happy, or you are actually very like interested, or you do, I mean, any kind of business, you can't just sit on your you can't just sit down and wait for people to actually do things for you. You have to get up and put in the work. That is actually what we're learning from Anelisiwe today. It's about the consistency and going out there and taking the lead. So before we actually close up, I want to check something here. You do say that you did mention that you used to do your home visits, right?
Yes.
So now that you actually have a practice, you do have patients that walk in.
Yes.
I want to ask you, how do you then cater for patients that are bedridden and can't make it to your practice?
Good question. So, so my practice still does home visits.
Okay.
Obviously, because of the demand right now, I've cut down. I used to actually do home visits. I'm in East London, but I used to do home visits as far as Medivasa. So
Oh, that is like King Williamstown.
yeah, other
The
side,
other side of King, on the
King.
outskirts.
Yep, I used to do home visits as far as Itimbaza. Just because I enjoyed it, and I enjoyed, like I said earlier, I enjoy empowering people. There's nothing more rewarding than seeing someone that you first on your first session when you were there, they struggled, and it's not only just them that struggle to get out of bed. It's also the family. They don't know what
Of
to do
course,
with
that is so
the
true.
person because they're afraid of hurting them. They're afraid that they're not doing it correctly. So it was it was quite rewarding for me, and that's why we still do home visits. So we just don't do them as much, and I've only kept it now to around East London. I We have made um, contact with other physios in and around the area that can do home visits. So I've got a lot of contacts for other therapists that work within the region that can get home visits. Um, yeah. Otherwise, in terms of home visits within East London, I still do some of them. It's just not as frequent as we used to. I think that was the question, eh? Yeah. I think that was the
That
question.
definitely was
Yeah.
the question. And thank you so much. So, if ever you're in East London and you are in need of a physiotherapist, Anelisiwe Mntambo is here for you. I mean, the guy is so serious. Ngetunana uze with this branded shirt up at studio. I'm sure you can actually see him on your live streams. So, please do not hesitate. If ever you feel like you need any sort of rehabilitation, the best thing that you can ever do for yourself is to go and consult, because the worst thing that you can ever do for yourself at this point kukuhlala kanti uzawuba sengxakini. So now, before we actually just close off the show, I want to know, you based in East London, abantu abafuna ukuxhumana nawe, where do they get a hold of you? Your social media platform, are you on social media? And if so, what are your handles?
Yeah, so our practice is based in Vincent.
Mhm.
It's 101 Western Avenue. It's a corner. It's at the corner of Western Avenue and Essex Road. So as you are driving from Caltex Garage, going up towards Hemingway's, those streets that go in there on your right, the road is called Essex Road. We're on the corner there. You'll see our sign there. I work with another occupational therapist as well, Mo Lepo and Mo. Um, in terms of social media, I am on Instagram and I am on Facebook. On Instagram, I am Stinger underscore Mntambo, but you can just search Anelisiwe Mntambo Physiotherapy and my name should pop up. Um, I won't go much on Facebook because I'm not necessarily very active on Facebook, but if you just search for my name, you should find me. And in terms of getting an appointment, you can WhatsApp me or WhatsApp us. Basically, it's 073 220 6381. And you can book an appointment. I'll repeat that again. It's 073 220 6381. And you can just send a WhatsApp. You can book an appointment anytime between 8 until 5. We're all open. And in terms of the weekend, it's upon it's certain conditions as well in terms of Saturdays. Yes, I think I've covered a lot there.
Yes, you did. Thank you so much. That is Anelisiwe Mntambo esixelela with social media platforms like esithi. If only you just search the name Anelisiwe Mntambo Physiotherapy, it should pop up on Instagram as well as Facebook for people that don't have Insta. And in number yabo for their practice is 073 220 6381 073 220 6381. Do not hesitate to make those calls. So before we leave, we are going to take the last comment from my sister SCT. I love the determination and the length that you guys take to help the needy. We are taking notes, babe. So umsebenzi wethu apha basically for this show, it is Champion Mindset with Dr. Vili. We are here to deliver what the people need. Abantu basically, they just mainly, I'm gonna start with people that are actually just chilling at home. abantu abahleliyo, abantu abafundayo besithi, this is the field that I'm interested in, and how do I get there? We also go to the business aspects of it to say, if ever you are a government employee and you are interested in starting your own business, how do we educate you and actually get you to start? This is why we bring such people here. It is 10 to 3. We are about to leave, and in Zanshia no spoke, no Budlestebe City, stay real. Anelisiwe, is there anything that you want to say to the listeners before we close off?
Thank you so much. Thank you for inviting me.
Pleasure.
It's been a pleasure. I'd like to just say to people that movement is medicine. Sometimes it's very easy to think that because you are in pain, you can't do much.
Of course.
Whereas actually, you need to try get a hold of someone that knows what's going on, such as a physiotherapist, to get you on the right track. Break that cycle of not wanting to move, and get moving, get exercising. Movement is medicine. And yeah, let's be brave. Let's reach our goals. Let's inspire each other. Yeah, that's it. Thank you so much.
Thank you so much, and thanks to everybody that tuned in namhlanje. Enkosi masiphinde sidibaneni in the next 2 weeks. Igama lami Dr Vili, and thank you so much, guys, for being patient with me. Because I'm actually just starting Kulo journey, and thank you for actually like walking through it with me. And now we are about to leave Ubudlesta. Nospogi bazan patela isho eti stay real. Bavayini and enjoy.
Here comes.